Khubsurat. 10 years ago, when the plague struck Surat, India's diamond capital suddenly acquired the dubious label of being one of the most filthy and mismanaged cities in the country. A blotch on India's map. Open drains, mounds of garbage, uncleared for months, breeding epidemics, a criminally apathetic municipal administration. It was all over the media. But the city has since undergone a total transformation. So much so that Indian National Trust for Art and Cultural Heritage Intact has judged it the second cleanest city in the country, next only to Chandigarh. Clean streets, wide roads, flyovers, and municipal cooperation that actually works. By any yardstick, Surat is the most livable place in Gujarat. Once it has the highest incidence of waterborne diseases in the state. Now it has dipped far below. Surat's revival is not just the story of local administration shaken out of stupor after the plague, it's the tale of the transformation of the collective attitude of around 30 lakhs of its citizens. The catalyst for this change was one inspired man, Surya Devra. Suryapur is incidentally the ancient name of Surat. Ramchandra Rao, a municipal commissioner with vision. The working model he put in place is still functioning more than 6 years after he has transferred from the city he set right. Before Rao, the Surat Municipal Corporation SMC functioned on the whims and fancies of commissioners of the day. Now the individual is out, the system has taken over, says former Deputy Commissioner of Surat, Ashwin Mehta. The change that Rao brought about has endeared him to the citizens. No wonder when he was transferred as a chairman of Vizag Port Trust, there was a public outcry against it. Even today people have fond memories of him and refer to him as Rao Sahib. Ironically, it was a reluctant Rao who took charge as a commissioner in May 1995. He had then considered Surat a punishment posting. 9 months had passed since the plague struck. The municipal administration was in a shambles. Rao identified the proliferation of illegal construction as the main problem. Almost 85% of the city lacked drainage and half had no piped drinking water. The new commissioner first took the staff of the SMC on his side and assured them of his full backing should there be any political interference. Next, he won over the citizens by proving that his work would improve the city and their lives. He also promised them that with their support, he could make Surat a city that Gujarat would be proud of. Many in Surat will tell you how they were embarrassed by the filthy city tag. With a roaring diamond and textile trade, there was no dearth of funds, says a leading businessman. We were rich people living in a huge pigsty. Only after the city became clean and garbage was cleared did we realize the condition we were living in all these years. Rao launched Operation Demolition, targeting the construction mafia and buildings without clearance. Initially, it was met with resistance, but soon the people voluntarily demolished their own shops and houses. Businessmen went in for demolition sales to clear stocks before they dismantled and rebuilt their shops. People broke down houses and called in architects to redesign, calls Mehta. A stage came when our staff just went and drew lines with chalk over illegal parts of the buildings and the people themselves took care of the rest. Once he had won over the people, Rao continued his good work. To deal with garbage on streets, the commissioner's next target was the sweetmeat shops and wayside eateries. These operated in most unhygienic condition but prospered because the average citizens couldn't care less. When newspapers published pictures of kitchens of these eateries with cockroaches and rats moving all around, they were shocked. Rao would be seen standing in the mess, ordering actions. The corporation staff were embarrassed as the frail jeans-clad commissioner walked into the garbage and slush, sometimes knee-deep. He ordered officials to learn first-hand the problem and decide on what must be done. After a few months, the commissioner stood in a corner overseeing the staff do their job. Soon the backlog of garbage lying for months was cleared. The blocked sewage system was cleared, says leading pediatrician Dr. Ashok Kapse. who has done several studies on the health problem of Surat. Most important was the sweeping of the streets at night. So when you go out on morning walks, you are greeted by a pleasant ambience and freshness. The people were delighted that this was possible in their town and compared the situation with the mess they lived with earlier. Now nobody wants to fall back on the old ways. The most palpable impact has been on public health, says Kapse. The incidence of waterborne disease has drastically came down by as much as 70%, which is a big achievement and an evidence of the close monitoring done by SMC, concurs Dr. Manak, Aswa Medical Superintendent of the Mahavir General Hospital. The rate of hospitalization due to waterborne diseases has come down drastically from 30% then to 10% now. Surat, says Kapse, once notorious for high incidence of waterborne epidemics, is famous for just the opposite. He explains why this change has happened. When the plague struck, the SMC had no idea about ground realities. Now there is a system in place. In fact, Surat is the only city in the country where the municipality is compiling data from its public hospitals and even reaching the private hospitals and practitioners to collect information. It is heartening that based on this data, the SMC regularly organizes cleanup and awareness campaigns in problem areas. While this was unimaginable in a place like Surat, such a practice is rare in any case. The current municipal commissioner G.R. Aloria is living up to the challenge and says, "You will be happy to know that now 85% of the city has a sewerage system while 10 years ago 85% didn't have it. Only half of the city then had piped drinking water, now there is 90% coverage." The SMC brochure calls Surat the city of the future, and for once the publicity pitch is not out of place.